Hello, 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 beautiful people. Happy Sunday. I'll give you guys a few minutes to get on because I have a couple of things I need to say, okay? So I'll give you guys a few moments. I have a special guest coming on with me today. I'm pretty sure you guys are going to really love this. We've actually been trying to get her in for a little while now, so it's actually very exciting that she actually agreed to come on with us today. But before we get started, I'm going to give her a few moments to log on. But I want to let you guys know that today is the last day for our special for February, okay, you guys? We are having two flawless facials and a Rose Pamper sample kit for you guys, all for $250 for the month of February. And we know February is a very short month. So today is the last day to actually receive that special. And when I say two flawless facials, I mean you and someone else. And that can be your significant other, that can be your mom, your brother, your cousin, your uncle, anybody. It doesn't matter. Even your baby if you want. If you have a little kid and you want to bring them in, you are more than welcome to do so to get this offer for $250, okay? I think she logged on, you guys, so I'm going to try to get her on with me. But today, you guys, I have a very special guest. She is a dermatologist. We've been trying to get her in for a while now. We are so excited to have her and her expertise. Today, we'll be discussing PCOS with her today, you guys. And I know some of you guys don't know what that is, but we brought her on here today with us to actually make us more aware and educate us on what it is, and what we can do about it, and how we can live our day-to-day lives if we do have it. So, let me see. I think she just logged on. See if I can try to get her on here. Give me one moment. Oh, there she is. Log on. Let's give her a few moments. If you guys have any questions, please. Oh, there she is. Hello, hello, hello. We are so happy to have you.
My name is Dr. Agassi. I'm from Dermatology. Nice to see you guys.
Yes, yes.
Everyone's
nice
doing?
to meet you. Oh, I thought it had broke up. But yes, nice to meet you guys. If you guys can hear her, this is Dr. Agassi. She is a licensed dermatologist. She actually owns a a dermatologist firm in Humble, and I actually live in Humble, so it's kind of funny.
Yes.
But we are so happy to have you here today with us. Can you tell the people a little bit about yourself?
Yeah, so I'm a board certified dermatologist, and I practice at Dermatology in Humble, Texas. So I've been practicing the last 10 years, and I practice both medical, cosmetic, pediatric, do surgical dermatology. So pretty comprehensive practice. Specialization in hair loss. So today I wanted to talk about PCOS and give some awareness about the condition.
Yes, indeed. Could you tell the audience what exactly is PCOS? A lot of people are unaware. In fact, I didn't know what it was until Kiki Palmer had actually made a post about it, making people more aware, and it kind of, went crazy from there. So could you tell our audience a little bit more about what it is and what it stands for?
Yeah, so polycystic ovarian syndrome, which is PCOS, is a condition where women have irregular cycles. They also may develop hair in areas that normally do not develop hair, such as on your chin. Some may develop hair on their chest, along their jawline. And also these women do tend to have insulin resistance. Now, with polycystic ovarian syndrome or PCOS may have ovaries that may have tons of cysts, but some women do not. But it basically is a condition with several symptoms. So irregular cycles, patients have facial hair, also known as hirsutism, and tend to have a tendency for metabolic resistance.
Okay. Oh, that's very interesting. And you said it's polycystic
Syndrome.
ovarian syndrome. Okay, cool.
Yeah.
I have a question. What is the cause, and is it curable?
Right now, we don't know of any cause. We
Mm-hmm.
haven't by any particular reason why it does happen. As far as curable, as of right now, we do not have a cure, but we can definitely control certain medications and certain remedies to control a lot of the symptoms. So there are a lot of medications out available, especially with ones we use in dermatology, to help patients who have such symptoms. But I wouldn't say it's more of a controllable condition rather than curable at this point.
Okay. I did a little research and I learned that there's actually multiple different types of PCOS, and I was not aware of that. I thought it was just, one form of a situation, and I didn't know that it was like it varies.
Right.
Could you please tell our audience more about those different types?
So there are about four different types of PCOS that we know about. One is called inflammatory PCOS. So the thought with the pathogenesis of that condition is patients who tend to be under more stress, have more inflammation in their body. They tend to have increased risk for elevated androgens, particularly known as testosterone. And then there's a type of PCOS, which is called insulin resistant PCOS. So these patients, these women tend to have increased risk for diabetes, increased risk and resistance. And then there's another type called adrenal PCOS, where our adrenal glands produces hormones. And our adrenal glands is the organ in our body that tends to produce more stress hormones. So that particular organ tends to produce a hormone called DHEAS. So it's a little bit different from the testosterone. And then last, post-pill PCOS, where after taking birth control medication, sometimes we see an elevation of your natural androgens start to increase, because with birth control, it suppresses your hormones. So
Right.
it's testosterone, it suppresses a hormone called DHEAS. So when you get off of those medications, such as, like, for example, Yasmin, those androgens start to get back to their normal level in the patients that do have PCOS.
Okay, that's very interesting. Like I had no idea that it could even get that deep, but that's very interesting, especially you said like for people who have diabetes.
Yeah,
That's very interesting because a lot of women in my family have diabetes. So
yeah. So a
uh,
lot of PCOS
yeah,
unfortunately have diabetes or are at increased risk for diabetes because they have insulin resistance. So there is a chance, even though they may not have diabetes currently, over some time they may be increased risk for diabetes because of the PCOS syndrome.
okay. And I know you said like over time, like does it get better over time? Like do the symptoms actually reduce over time, or does it get worse as with age?
I would say it actually gets better. So the PCOS,
Okay, good.
because of the multiple cysts that tend to develop on the ovary, there's a ton of follicles there. So your follicles contain eggs. And when you're younger, you have a ton of eggs. So patients who have PCOS tend to have worse symptoms because all of those eggs are producing elevated testosterone. Now, as you get older, as you reach into more menopause, naturally our eggs start to decrease. So we have less egg production, therefore you're going to have less of that testosterone being produced. So that is one of the symptoms of PCOS. You have elevated testosterone, elevated androgen levels. So with age, as your eggs start to decrease, the testosterone decreases, and therefore the symptoms start to improve.
Okay. Um, Well, I know you know that we are a natural skincare line, and you know we believe in everything natural. Are there any natural products or like home remedies that you would recommend for someone to reduce their symptoms?
Yeah, so there's a couple things you can do naturally. So I think that with dermatology, we can definitely combine both natural remedies and more prescription medication. But as far as naturally concerned, I would like to recommend more retinol products. So retinol is vitamin. So vitamin A is a natural vitamin that you can use in your skin that can help reduce the blackheads, helps reduce the whiteheads, as well as helps increase cell turnover. So a lot of the discoloration, the dark spots that the acne creates can improve with vitamin A. So that's one of the great topicals that you can use, and that's a natural medication. Additionally, I would also recommend salicylic acid. So salicylic acid is derived from willow bark. And so salicylic acid is good for acne. You can use that in washes. You can use that in toners. You can actually use it as a spot treatment for acne breakouts. So that is a good option that can help patients that have PCOS who have acne.
Okay. What about like natural oils? Like, is there any like oils that you recommend that some or serums, preferably that someone could put on their face?
So oils, I'll be careful with oils because naturally oils are going to possibly clog up your pores. So they're
Right.
hygienic, which means risk for clogging the pores. So actually don't recommend oils per se, but I do
Mm-hmm.
recommend serums. I think serums are great. So there are some serums that have particularly salicylic acid, which will help to break up the blackheads, the whiteheads, and help clear up the acne faster. So that's a good product that you can use inside of a serum. So if you're looking for serum products, looking for the salicylic acid or willow bark derivative is going to help with acne. So serums are great. Oils, I wouldn't recommend so much.
Right. Okay. Um, is it true that you gain like weight if you have PCOS? I know a lot of people. I've heard that before, and I um wasn't quite sure about that,
Right.
but I was actually interested to know as well because I know earlier you didn't mention that as one of the symptoms. But
Right.
is it true that you can also gain weight with PCOS?
You actually can gain weight with PCOS because it is a metabolic syndrome where patients do have increased risk for insulin resistance. When you have
Mm-hmm.
insulin resistance, you may have difficulty actually losing weight. Therefore,
Right.
it increased risk for weight gain. So not all patients who have PCOS have increased risk for weight gain, but some patients do, especially the patients who have more insulin resistant subtype of PCOS. So it's definitely a possibility.
Okay. I know you said like facial hair, like is a facial hair, would it also like be like excessive hair on the body as well as long as facial hair? Um, Go ahead.
Absolutely. So you can develop. So hirsutism is a term that we describe hair in inappropriate areas. Hair where women don't normally grow hair. So that could include the chest. That could
Right.
include abdomen. So that are definitely areas where you can have more hair than normal, which is called hirsutism. So that is definitely one of the major findings of PCOS. Thankfully,
Mm-hmm.
so yes, hair growth is a really big finding of that condition. Both.
Okay, that's very interesting. Okay, because yeah, one of my coworkers was trying to educate us a little bit on it. Like I
Yeah,
said, like when the Kiki Palmer post had went out, like a lot of people added us on our page and was like letting us know, like, hey, I have PCOS. Like, hey, like y'all have products for this, and we do have products that can help them, like in a system. Probably not, like you said, there is no cure, like help cure them, but
right.
definitely help them maintain. Um, and I know there's like a lot of young girls, because my coworker that was informing us about it, she's actually really young. I'm 24. I believe she just turned 25. She never told us exactly what age she was diagnosed with it, but what age is a healthy age to actually, go see a dermatologist and actually get diagnosed with PCOS?
I would say most of the time, most people are diagnosed in puberty, and that's
Okay.
so your symptoms, because during puberty, their hormonal changes are starting. So women or young ladies are starting to have increased hormone changes. So therefore increased androgens, which is the testosterone. So definitely during puberty, some people get diagnosed. I think some people get diagnosed as an adult. But a lot of the times it's during puberty, those symptoms start happening where you start having irregular cycles. You start
Mm-hmm.
hair in areas you normally wouldn't have hair, and you start having maybe increased weight gain that wouldn't be typical of what has happened before. So those symptoms can start in puberty because of the normal hormonal changes during puberty.
Right. Okay. And can PCOS be passed down? Like, is it a hereditary thing, or this is just like you said, just something that happens like during puberty?
There are some people that, or some families that have genetic tendencies for it. So if you have your mother have PCOS, then there is a chance that your daughter can also have it as well. But some be the first person in your family that could have that condition. So there are some genetic risk for it, for that condition as well.
Okay. Also, speaking of genetics, or children,
Yeah.
is it difficult for a woman to like who's interested in having children and starting a family? Is it difficult for her to conceive if she has PCOS? And if so, what are some things that she can do to have a baby?
So PCOS, because it is a condition of hormonal imbalance. So when we have a hormonal imbalance, we need our hormones to be within a normal range to be able to conceive. So when you're trying to conceive, there is some difficulties, unfortunately, because of the elevated testosterone. When you have elevated testosterone or even elevated DHEAS, that causes some women to not ovulate. And if you're not going to be able to ovulate appropriately or have regular cycles appropriately, then the chances of being able to conceive are significantly diminished. But it's treatments, a lot of treatments available. So I would
Mm-hmm.
definitely recommend PCOS, they would need to see, for example, a board certified endocrinologist or reproductive endocrinologist, an OBGYN, and they can be able to test the hormones, give medications to help induce ovulation. So because PCOS may have, women that have PCOS have some difficulty with ovulation, they can give medications such as Clomid, which is a tablet to help improve ovulation and then help improve conception rates.
Oh wow. Well, that's very nice to know because I know another thing. Like I said, my coworker, she was letting us know about it. Like, I mean, she doesn't know too much about it, but like I said, it was like a big conversation in our office because there's so many people were contacting us about it, and it's like we didn't properly know how to answer questions and educate them, and that's why we reached out to you to
Yeah.
actually get a professional who can properly let us know and properly educate our audience because I mean it is a popular topic. A lot of people have this condition, and it's like it's not really talked about.
Right.
And here on our platform, we like to talk about those type of topics to help each other.
Yes,
So,
it's very common to have it and may not even know they even have it. And so they may suspect they
mm-hmm.
have it, but really consider doing some blood tests to check your hormones, because that can be able to give you the final diagnosis. But definitely, a lot of people have. I would say it affects about 3 to 10% of the women with this condition. So it's actually so.
Oh wow. Okay. Um. Well, that was all the questions I have, but I know some of our audience has some questions. I believe I know I seen one earlier. Let me see. Oh goodness. Never mind. One somebody said, "Is this something that people with sensitive skin usually have?" But I
So
think you said it was like for everyone, right?
yeah, anyone with different skin types can get it. So you can have sensitive skin, you can have combination skin, you can have oily skin, and you can still develop this condition. So the skin type is not what dictates the condition, but some people are. I would say that some people are just born with it. So it doesn't start
Yeah.
out until you reach puberty because that's when the hormonal changes starts to kick in. But
Mm-hmm.
I can definitely have PCOS symptoms.
Okay. All right. Well, um, I believe those are all the questions I personally had. If there's any more tips that you'd like to share, we'd love to hear them. Usually our audience has all types of crazy questions. I think I probably hit it on the nose this time with the questions that everybody had since since we last talked to everybody about it
Okay.
from our previous post. But if you have any more like tips that you could possibly give our audience, we'd love to hear them as well.
So as far as tips, I would say that if you notice that you start having irregular cycles, definitely reach out to a physician, reach out to your OBGYN to see if you do have PCOS, because it is fairly common, just to make sure that you get treated appropriately, get treated on time. And then if you suffer some of the symptoms of PCOS, such as acne or hirsutism, see a dermatologist, to see a certified dermatologist to get treated as well. So I think that it's really important to, if you have any of those early symptoms, see a doctor pretty soon.
Awesome. Okay. Well, speaking of doctors, since you are one, we'd
Yeah.
like to recommend all of our customers to you who have
Oh,
PCOS. So could you please tell them where your office is and where they can find you on social media?
yeah. So my office is located in Humble, Texas, which is a little bit outside of Houston, and you can reach us where I'm open pretty much Monday through Friday. So you can always call us on at 281 707 6400, and our Instagram
Mm-hmm.
Humble Dermatology. So it's pretty easy to remember. And then our website is www.humbledderm.com.
Yes, you guys. I will also leave her at down below, you guys. So you, if you guys missed any of this conversation, it will be on our IGTV for you guys to see with her information. But we appreciate you taking the time. We really have been trying to get you on here for a while now.
Mhm.
And like we're so excited to have you. We'd love to have you again next month sometime if you're available. But I'll email you. I'll email you with those details.
Fighting me.
Oh yeah, of course. Also, you guys don't forget we're still having our February specials, 2 flawless facials and our rose pamper kit for $250, and that's in our Houston and Atlanta location. So if you guys are interested, today is the last day of February to receive that. But thank you so much for tuning in with us, and we greatly appreciate having you.
All right, you guys have a great Sunday.
Thank you. You too.